I'd like to introduce our guest host, Miriam Sinati, Managing Director of Content at St. Joseph Media. Thank you, Miriam, and take it away.
Thank you, Chantal, and thank you to everyone for joining us this afternoon. It's my pleasure to welcome Dr. Rodolphe Barrangou. Dr. Barrangou, I'm going to call him Rodolphe, is a distinguished scholar in probiotics research at North Carolina State University, and he's the lead of the CRISPR lab. We're going to be finding out all about CRISPR-Cas systems and his work during the next 45 minutes or so. His research focuses on the understanding of the genetic basis for health-promoting bacteria, beneficial bacteria used in food. And along with his colleagues, Dr. Barrangou has established that CRISPR-Cas systems provide adaptive immunity against viruses and bacteria. I think I've sort of summarized it as best as I can. Welcome, Rodolphe. Nice to see you today.
Good morning.
Now you're joining us from Raleigh, North Carolina, where you work at the university. Before we get into this discussion about the science, I'm curious as to how you're doing in lockdown. North Carolina is just coming out of its lockdown as in phase 2, slightly ahead of us here in Toronto. How is that looking for you there?
So for me, it's been fine, right? I mean, I'm safe and healthy and okay. But to be honest with you, this has been an unbelievable, maybe in the truest sense of the word, hard to believe last few months. As you mentioned, North Carolina has been pretty proactive and slightly ahead of the curve in terms of managing disruption and anticipating issues and locking down. So we're currently in phase 2. I think our governor and university leadership have been very good at making science-based decisions and keeping up with the science more so than the politics and business ramifications. And things look good, but to be honest with you, since we have been in phase 2, there's been some early numbers that could be somewhat concerning. So we're really keeping a very close eye on the situation, the cases, the numbers, the positives, the hospitalization rates. So we're cautious about maybe thinking about 2.5, right? We're not going to go to 3, but maybe 2.5. But there's some signs that we have to keep measures in place right now. And we'll see if we stay in 2 or move to 2.5 or hopefully not go back. So we've been ahead of the curve so far, but hopefully we'll remain that way. And there's some reasons to be concerned with some of the early numbers we get from the last 2 weeks.
And I think we're seeing that in a lot of places that have gone into phase 2, that those spikes, and I guess the job is, can the healthcare system take care of those spikes? Will it revert back to an even bigger spike? I'm curious, as a scientist and a researcher and someone who works with other scientists, how did this lockdown impact your work? Is your work and your scientific research, is it naturally sort of adaptive to a physically distanced environment, or did it change it quite a bit? How have the last few months been for you?
So it's been extremely impactful, to be honest with you, and it's also been very disruptive. So we had to shut down the lab, but because we had a COVID-19 related project, we were able to reopen it for a small number of people, and then we went into phase 2. So we're at about 30% capacity today. So we're operational to some extent, but it's been very disruptive in terms of teaching, right? I'm a professor, I give classes too. We had to shut down the lab. We had to stop all travels. We've had no face-to-face business or scientific meetings in the recent past. And I think some of those things are here to stay. I think teaching online is going to be part of what universities do. Giving seminars remotely, like what we're doing today, is going to be part of the new normal. I've given, I think, more talks than I even typically give. Some of them have been in person. So I think there's some gains of flexibility there. And I certainly enjoy not having to travel as much. But in terms of being able to carry out the work in the lab, people have to be there to do experiments. So we've had to work on shifts to observe and respect social distancing rules that are in place right now. And to be honest with you, too, some people are not very comfortable, with sharing space in a confined building, in a confined room. And I've had no issues in my lab, but we've seen people at the university express some concerns about PPE, personal protective equipment,
Yeah.
traffic, and using the restrooms and access to hand washing stations and the like. So I think it's been extremely disruptive, and this is just still at an early stage of learning to manage pandemics like this. That being said, though, it's a great opportunity for people to show their ability to be adaptive. It's a great opportunity for organizations and businesses and universities and governments to display and showcase their ability to manage adversity, and adapt to changing environments and changing conditions. And I've seen some people really do a good job at going back to their basic core values and who they are and who they want to be and how they manage their employees, how they manage their colleagues, how they manage their relationships. And people who do that very well I think, are better off in that sense because they know who they are and how they want to do things.
And that's so interesting. So what you're describing, and you said this might have a lasting impact, is sure to have a lasting impact in your teaching, but also a lasting impact in the way labs, I guess, function. Are there innovations that have come out identifying people who are adaptive to this? Like, how is this going to sort of set up a new future in scientific work and the way your colleagues work together?
So I think being productive when working from home is a huge shift, right? Historically, especially in students and postdocs and young trainees, managing your time, managing your effort, managing loneliness, managing being alone, and managing on how to work in teams from a distance standpoint is very challenging. Some people still struggle with this. Again, I've seen this firsthand. I've heard about this secondhand. But I've been very impressed with the ability of a lot of trainees and students and young professionals to really manage their time. I ask people to tell me how they spend their time every week when they work at home. And I've seen increased efficiency in email traffic and reports and data analysis and writing papers. And so I think it was refreshing maybe to some extent for some people. And some of the companies that I work with have told me, they think that going back for people who don't need to be in person every day at the office, they speculate already, and some are planning for changing their footprint because they do not expect that 100% of the people will be there 100% of the time every day. And some people will work from home 1 day a week, maybe 2 days a week. And it's enabling people to be more flexible with a life-work balance. It's enabling people to not waste as much time transitioning and commuting and traveling. That being said, some of those face-to-face meetings, have to happen in person. When we talk about business, when we talk about true collaborations, when we talk about ideation stations and brainstorming and roll your sleeves and work together, those are very important and will happen. But I think people would be more strategic with regards to how they use their time and where they work from, and also how they work. And I've been very impressed. We'll see if this lasts, with the ability of people to really manage their time more efficiently and embrace the work from home new routine to really generate more information, more data, more papers. And we see in the academic world a lot more grants as well, which poses their own problems. But we'll see more about that in due time.
And what you've described, I mean, the scientific work you do and the work I do in media, they couldn't be further pulled from each other. But I think many of us are experiencing what you've just described, and across all sorts of different industries, and reevaluating the way we worked in the past. So let's move on to actually talking about the work that you do, which I find absolutely fascinating. At North Carolina State University, you're a distinguished professor in probiotics research. You really have pioneered food science, so one of the pioneers of food science. And that involves developing new technologies for safe, for efficient genome editing that is non-GMO. So in this area, CRISPR-Cas9 has been hugely defining. It's enabled a new way to edit DNA. I think the terms CRISPR and CRISPR-Cas, CRISPR-Cas9 are largely unknown to many of us. And if we know anything about it, it's really, we have read about how it's a gene editing tool that, in a sense, protects bacteria against viruses. I don't know if that's too simplistic a description, but could you describe what it is and how it works?
Absolutely, yeah. So again, it's not going to be a lecture. I'm not going to present any slides or data. I just give the CRISPR 101 overview. So there's a strong distinction between CRISPR, the scientific phenomenon in nature, and CRISPR, the technology that enables genome editing. So from a scientific standpoint, on this side of the equation here, CRISPR is an acronym that stands for Clustered Regularly Interspatial Palindromic Repeats. It's a mouthful, but it's very descriptive in regards to what it actually is in nature. And it is, as you said in your introduction, the adaptive immune system in bacteria that enables bacteria to cut very efficiently and specifically viral DNA when they get infected. So in nature, CRISPR is an antiviral system that enables bacteria, like a molecular scalpel, a pair of scissors, to cut viral DNA. What CRISPR is today is a tool, this molecular scalpel, that enables scientists to cut any DNA they want in a programmable, specific, and strategic way. And it's like a cursor in Word. You locate your molecular scissor at a genetic sequence of interest to you, and it enables you to change the text at this very precise location. That's why it's called editing. We have the ability to go into text in DNA, cut a piece of DNA of interest, and change the DNA sequence at that location. So the immune system in bacteria enabling phage DNA cleavage can be used by geneticists to cut DNA virtually in any organism you can think of, a virus, a bacterium, a human, a tree, a plant, livestock, butterflies, things you see and things you can't, and then rewrite or edit their DNA precisely at that location. And in the last 7 years, this CRISPR technology has enabled hundreds of thousands of labs throughout the globe in over 100 different countries to edit virtually the genome, but also the epigenome or the transcriptome of any organism you can think of. And this is why it's so impactful and mesmerizing and amazing and promising and concerning at the same time, because it means that this democratized technology across team science enables virtually, your average geneticist, quote unquote, to tinker with the genome of anything you can think of. And it has great promise for medicine and ag and food and bacteria and trees and livestock and crops, and of course humans for gene therapies and the like. But it also has huge implications and concerns with regards to our ability and our power to rewrite all those genes.
Wow, that's amazing work. So is it about, if we were to take an example, is it about editing mosquitoes so they can't spread malaria, or editing fruit and vegetables so they're more flavorful and maybe even more nutritious? But how does this differ from GMO? How does CRISPR differ from genetically modified organisms?
Yeah, so now we're talking about a technology that is so disruptive and innovative that the regulatory processes that regulate whether it's GM or non-GM, GMO or non-GMO, have to catch up with the science, right? So science is, pun intended, at the cutting edge in this particular case of DNA. And regulators have to catch up with that. And of course, the public has to catch up with that to understand, is it GM or non-GM? So currently, most scientists who use this technology to change things that we eat, for instance, right, whether it's bacteria or crops or livestock, use versions of CRISPR that do not fall under a genetically modified organism regulation or scientific definition. So to give you an idea, we can actually use those scissors without using DNA. So we can change DNA and edit DNA in corn and maize and wheat and rice and all those things without delivering DNA and making them transgenic. And most people are using CRISPR to replicate or recapitulate in organisms of interest sequences that exist in nature, in other strains of corn, in other strains of wheat, in other strains of rice, in other strains of livestock. And they just use CRISPR, quote unquote, to replicate natural breeding results. But they do so 10 times more quickly and maybe 100 times more affordably. So in that sense, genome editing, as it is used under those guidelines and umbrellas and purviews, those products are not falling under a genetically modified organism, transgenic, unnatural, synthetic regulatory framework. That being said, though, you could do it if you wanted to.
Right.
But at this point in time, the first generation results of CRISPR-based editing and breeding in the food supply chain does not fall under GM-regulated guidelines whatsoever.
Oh, I see. So, and this is part of the work that you do is around probiotic strains of bacteria. So CRISPR-Cas systems can be used to engineer, designer, I don't know if that's a word to use here, but probiotic strains. Can you describe a little bit about that? And we, our public, again, the general public has a sense of probiotics being a certain thing. It's a tablet or a syrup that we take. It kind of like, strengthens the gut and is like good for you in a sense. But what do we not know about probiotics? And can you describe your work in this area?
Yeah, I think yes, people are to some extent familiar with the concept of beneficial microbes, right? We eat a lot of bacteria on a daily basis. As a matter of fact, much of the global, even Canadian food supply chain, some of the best products come from fermentation processes that are made by bacteria. You can think yogurt, you can think cheese, you can think organisms that make beer or bread or wine or champagne and all combinations thereof, or hipster products like kombucha and kimchi and the like. So people are familiar with bacteria that are not always responsible for infectious disease, and they know that some of them are beneficial. That's why you eat yogurt, or that's why you eat dietary supplements or tablets or powders or capsules that contain a very high level of beneficial microbes. And people also understand today the huge importance of the microbiome, right? The collective of organisms that live in us and on us and with us that enable us to advance our health, right? It's digestion of things like lactose, it's fending off infectious disease, it's having the right level of inflammation or not in our GI tract and various epithelia. So a lot of food companies rely on those bacteria to provide a healthy, health-promoting, tasty, tasteful, and also sustainable food supply. So what we do is we use various CRISPR-Cas technologies and various applications that span a very wide spectrum. I mentioned early on, CRISPR is an antiviral in bacteria. So people have been using CRISPR to fend off bacteriophages that are responsible for huge losses in the dairy fermentation industry to make cheese and yogurt for 10 years already. So if you had a bite of yogurt or a bite of cheese or some poutine recently, or if you had some nachos or cheeseburgers anywhere in the world last 10 years, I can guarantee you have consumed a product that was fermented using a CRISPR-enhanced phage-resistant commercial starter culture, right? This was commercialized in 2011, almost 10 years ago, but not quite. But besides this, nowadays we can use CRISPR, as you mentioned, to enhance and breed, quote unquote, better probiotics to control their ability to manage inflammation in our GI tract, to control their ability to help us digest plant-derived oligosaccharides, or to help us, or to help them, and as a consequence, help us digest the complex sugars that are in human breast milk, for example. So we can really engineer, as you mentioned, rather like the word biodesign, for increased health and desirable traits, the ability of those organisms to provide a healthier and a safer and a tastier food supply. And I always talk about yogurt because I like yogurt. And as a matter of fact, the texture of yogurt, right, the ropiness that makes it gel-like or liquid-like, depends on the ability of bacteria to make certain polysaccharides. So it's not a chemical process, it's a biological process. And controlling how those bacteria make those polysaccharides helps food formulators and food scientists to control the texture of yogurt. So it can be as simple as this, the flavor of cheese, and on and on and on.
Mm-hmm. Wow. So earlier you said that, that this is a disruptive technology. And you've been very much at the forefront of saying that you believe there are challenges ahead of us that really warrant the use of these kinds of disruptive technologies. You've mentioned some commercial applications, and we'll get to the commercial applications and how to commercialize academic research in a minute. But I want you to talk about why you feel that this kind of disruptive force is preparing us for the future.
Yeah, I mean, I big issues and big problems require big solutions and big science. So oftentimes when things are difficult or challenging socially, economically, politically, people say we'll need a moment of silence. And to me, when I see big issues, right, a pandemic, virus, genome editing, global warming, climate change, I tell people we need a moment of science, right? Because science and technology are going to enable us to solve our problems. So in the food realm, when we talk about sustainability and land usage and water usage and disease and pest, right, for agricultural crops, use of antibiotics or abuse, of antibiotics, but also global warming. How do we sequester carbon, and how do we use less water, and how do we make better use of the limited arable land that we have on hand, right? Or how do we feed a growing population, or how do we control the amount of meat, or maybe make impossible meat, right? All those things are anchored in science and technology-driven solutions and formulations. So we need technologies like CRISPR, like machine learning, like artificial intelligence, like the microbiome, like bioinformatics and big computing. We need technology and science-driven big solutions that enable team science. There's about 8 million practicing scientists on the planet to come up with new ways, new means to more flexibly, more efficiently, more quickly, certainly, and more affordably address all those challenges. And when it comes to breeding and farming and managing livestock and our food supply chain, those solutions have to be science anchored, and breeding being such an important part of farming for millennia, right? And our society, we need to be able to harness, leverage in a timely manner, an efficient manner, and sustainable manner, breeding technologies like CRISPR to solve our problems today. And that's why I love always the example of the impossible food, the impossible burger. It sounds impossible, right? We're gonna make meat-free meat, like non-meat meat, and it's gonna taste like real burger, right? And historically it hasn't, and now it does. And you need science to solve that problem. And it sounds impossible, but actually it's a fairly good product. I've consumed the Impossible Burger numerous times, beyond meat as well. And it sounds like science fiction, but it's just science. You take the fiction out of that, and we have to science our way through it and engineer our way through it. And now the challenge is to scale this up, right? To feed all those billions of people, not a few 100,000 hipsters and avant-garde people who say, I want to try that out. Sounds cool, sounds interesting, sounds responsible, sounds sustainable, sounds intriguing, and we do the experiment. But now scale that up to feed literally billions and billions and billions of people. And the solution to that is going to be technologies like CRISPR and machine learning and big data and precision farming, and bioengineering of flavors and textures in plant-derived material that make them feel and taste and smell like real meat.
So the application of the science, the impact of the science is widespread. And you mentioned some examples to do with food security. Could you maybe expand on that a little bit? Like, how is CRISPR going to help us with our future food security issues?
I mean, we have a lot of issues with food, right? Food safety, food security, food access, food sustainability, food pricing, even food imports and exports, right? There's all kinds of issues that we have to address, and we have to do so more sustainably than ever, more scalably than ever, preferably more locally than ever, more affordably than ever. So we need to harness the full extent of science and also biodiversity to bring back their heirloom tomato, right? Not just to do, number 5 bland corn, but have things that are tasty, can be customizable, can be scalable, can grow with less water, can grow more efficiently with higher yield, or can now grow in hydroponic conditions, right? Not on a farm, but actually in a closed building where there's no access to the sun, or maybe somewhere down in the basement in Toronto, right? Or on the rooftop of something that doesn't have a lot of sun year round. So I think we need to access and exploit to the fullest extent possible all those technologies that are disruptive, like CRISPR, to really breed enhanced foods and enhanced ingredients and enhanced formulations, and also not just do so for people who can afford it today or people who can afford it maybe tomorrow, but we need to do so for people who can't even afford it 5 years from now. Because we have to solve those problems, not just for NAFTA, I'm not going to go politic here with the US and Canada, but we have to solve this problem for everyone. And we have to use those scalable technologies to not just feed, the 1.5 billion people that can afford it, but all the people who are struggling to get access to secure and health-promoting foods. And if we don't do that now, if we don't do that quickly, if we don't do that with a sense of emergency and urgency, we're going to have issues that are going to be going way beyond a scientific or economic problem. We're going to have social, geopolitical issues. And that's why we see, hundreds of thousands of readers across industry and academia and across the globe. I'm talking people in, South America and, Central Africa using CRISPR-based genome editing to look at local species of interest, right? Like the sweet potato or cassava, right? But also, vegetables and local vegetables and fruits and crops. Or you can think of things like, citrus greening in trees, or, bringing back bananas and diseases like this that are really wiping out a whole species. Can we use those technologies to breed better and more robust and sometimes drought resistance, sometimes heat resistant, sometimes water resistant, sometimes pest resistant or insect resistant or virus resistant organisms across the tree of life, pun intended? And that's what we're doing today. And we're seeing this happening at a pace and scale in time and geographically that is unprecedented. And that's the power of democratized technologies like CRISPR.
At the very beginning of this talk, you also mentioned when the lab was reopening that there was a reason, a COVID-related reason that that the lab was reopening. And of course, we've been talking a lot about food and agriculture, but the impact of this kind of research on science outside of food is also considerable. Can you talk a little bit about COVID detection and how CRISPR is used in that, and also in the treatment or identification of orphan diseases? And if you could first start with COVID and then talk about and define orphan diseases and other applications of the science.
I mean, absolutely. And this is what's really inspiring to me, right? If you look at the data, the publications, the funding, the efforts underway, we've already had like well over 1,000 COVID-19 papers published in the last couple of months. So team science can get together and redirect their efforts when they wish and they feel compelled to do so with a sense of urgency extremely quickly and extremely well. It's still hard, it's still difficult, it still takes time. But there's right now 3 different avenues of using CRISPR to solve the current pandemic underway on a global basis. The first one, as you mentioned, is detection and diagnostics. So 2 CRISPR companies that came out in the last 2 years that used CRISPR tools to detect DNA have shown in the last 3 months that you can use flavors of CRISPR that target RNA to specifically, and they provide a proof of concept to do so, target coronavirus RNA. And those 2 companies have both announced in the last 2 weeks deals with top 5 giant pharma companies to scale that up and manufacture it scalably as we speak. This is happening right now in real time. Those 2 companies have announced deals in partnership with big pharma to bring CRISPR-based COVID-19 diagnostics to the public, to hospitals, and to the world. So that's the first one, because we need to be able to detect to assess the problem. The second issue is antivirals. And there's a paper that came out in Cell 2.5 weeks ago that shows that actually those flavors of CRISPR that target RNA and cut RNA, not DNA, have the ability in the lab setting to target coronaviruses and inhibit them and essentially kill and eradicate them, right? Now, we're a long ways from showing this in patients, right, and humans, but that's a first proof of concept that's critical towards harnessing the potential of RNA targeting CRISPR to work in a real setting. So that's very encouraging. And the third one, besides antivirals, and we've heard about this ever since the pandemic started, is vaccines. We need vaccines. We need team science. And it takes a long time, right? Tony Fauci says it all day long. It takes time, and it's hard. Sometimes it works, sometimes it fails. We have to be patient, but we can afford to be patient. So that's the challenge of team science here. So there's about 600 different projects underway, according to my latest count, of different projects in the world, some small scale, large scale, state level, big funding, or kind of ad hoc, one lab at a time. So there's a lot of people working on this right now, and there's a lot of approaches being considered. So for example, in my lab, we're trying to engineer in probiotic bacteria for an oral vaccine portions of coronaviruses and some of those immunogenic proteins to express on the outside of the cell to expose our immune system to it and proactively and prophylactically build our immune system before we ever see it with a proxy oral delivery, right? It's kind of a moonshot, it's kind of, crazy ideas, maybe it works, maybe it won't. So we're working on this and having more shots on goal, right? And trying crazy ideas. It might work. That's the advantage of science. And if 90% of those things fail, or 99% of those 6 fails, if we have 600 projects, I'm very confident we'll find a vaccine. And if not us, someone else. And most likely someone else, as a matter of fact. But having 600 shots on goal is very inspiring. You can recycle old drugs, combination of drugs, new drugs, antivirals, and on and on and on. And we're seeing, I think it's a safe bet to say every single large pharma company interested with active vaccine research projects has multiple COVID-19 related efforts underway. And they're dedicating resources, a lot of smart people, ingenious people, crazy people, creative people, disruptive people that are using all those things. And many of them are using CRISPR, but not all of them are using CRISPR. So we have to hedge our bet to some extent. And we only need 1 in 600 to work to have a solution to our problem. So that's why I think there's many reasons to be not just inspired, but confident in how team science is going to have a moment of science and solve our problem today.
Mm-hmm. All of those, I mean, everyone is sort of thinking about the vaccine and the vaccine timeline, and I won't ask you to put a timeline on it because I think that's probably one of the most annoying questions that scientists can have these days. I mean, it takes a while. But I'm just curious about, all of the crazy people and the scientific people and the companies and the government all sort of working together. Is this, is there, when you get so many disparate parties involved in one cause, there's bound to be bottlenecks, or there's bound to be sort of miscommunication or not shared goals. In your experience with what's happened to the world and the way the scientific community at large is coming together, are those things, those potential roadblocks being overcome? Are things happening as they should be, as quickly as they should be? What do you think about how the world is working together here?
Yeah, so it's hard. As you point out, it's very hard. There's many things that have to go right, and oftentimes it only takes one thing to go wrong to cave the whole issue. But conveniently, right? There's a lot of people who are entrepreneurial, and the solution may come from science, but the product will come from entrepreneurs, visionary business leaders who understand how to put together all the ingredients you need to execute and deliver a product, not a scientific solution, but an actual product that consumers and patients can use. So, I mean, in the last 10 years, I spent a lot more time in my life and my own work and my own activities to understand entrepreneurship, to be involved in entrepreneurship, to work with companies, to translate the science and turn it into a product. And you need that basic science understanding and use some of the scientific understanding to develop technologies, and then apply those technologies to eventually manufacture products that are regulated and tested and safe and efficacious and regulated and delivered to the public. So you need to do all those things. And entrepreneurs and business visionaries are the people who have the most potential to execute and put together all those and overcome all those challenges, and put together those ingredients and overcome all those challenges in one shot, and make money with it, but solve problems with it, right? That's their incentive to do it, but they have the ability to do it. And we saw that with diagnostics, and we're going to see that with vaccines. That's why, the best scientists that may come up with this solution will have to partner with people who can actually make hundreds of millions and hopefully billions of doses to deliver and spread across the world, right? Some people can afford it, some people not. So how are we going to work the economics and make that happen? Well, we're going to have to figure that out. And it's not a scientist who's going to solve that, it's an economist who's going to solve that. And how we're going to ship them and deliver them, and the cold chain, right? You need a lot of logisticians to solve that. And politicians will surely get involved with sharing the credit for that. So this is why, to me, those entrepreneurs who understand how to solve the problem from a meta standpoint and say, we'll take the best science and the best tech, and we'll accelerate that testing clinically, and we'll confirm that it can be regulated easily and quickly, and we'll have the dossier and the efficacy and the safety and business support, logistical support, manufacturing support, and buy-in from regulators to bring that solution to the world. The hats you need to have and be able to wear to solve those problems come from entrepreneurs and business-minded people. And that's what I love about, the Toronto community, right? I mean, I've had a chance to speak with many of those brilliant, inspiring people a few times already. And that's why I think, to me, it's a business impetus and a business mind and entrepreneurial spirit that will eventually enable the products of science to be brought to the publics and the consumers.
Yeah, and you mentioned Toronto as being one of the hubs for really, we have Mars, the Discovery District here. We have incubators for scientists and academic researchers to commercialize their ventures and their businesses. And CRISPR-Cas has certainly enabled the founding of these science-based businesses. One of them is yours, Trico. So Trico is something that you started. I wonder if you can tell us a little bit about that, and how it's come out of a business coming out of the science.
Absolutely, yeah. So again, I've given talks at Mars before, so I can really relate to some of the people in attendance today. And as a food scientist, I see this as a food recipe, right? You need to have a great recipe and a great chef and great raw material, hopefully a little bit of French wine, a little spice, and so you need to bring together all those pieces to have a successful enterprise and company. So when we think about CRISPR, oftentimes we think about medicine and we think about breeding, ag and crops and livestock. But a couple of years ago, I went into a tree breeder, right? And breeding trees is a whole new challenge from a timing standpoint. It takes forever to grow, right? I think growing corn is slow. Growing trees is an order of magnitude slower. And they're orders of magnitude bigger and taller. And their genomes, the genome of a tree is 10 times the size of our own genome, right? They can do things that we can't, like photosynthesis and others. And they live hopefully much longer. So we, put together all the ingredients that I just mentioned with great CRISPR science and the ability to breed applied to trees and not corn, and great technology and great business leaders to address grand challenges. And the challenge that we're trying to solve here is global warming. And we hear all day long, and the Canadian-owned Prime Minister talks about trees on a regular basis, planting 1 billion trees. Right? Some people want to plant 1 trillion trees, but they never tell you which trees, which variants, and when and where and how they're going to plant them. And anybody who can count to 1 billion knows it's a lot, right? And 1 billion trees, you can imagine, is going to be huge. So we're trying to solve that problem by harnessing and exploiting, cutting edge, again, pun intended, genome editing technologies to breed a better forest that's going to be more sustainable, that's going to enable us to sequester more carbon, hopefully use less land, and also, because we understand that a little bit better, be able to be more amenable to processing. So if you think of the paper industry, right, a major product of trees besides timber is paper. And the pulping industry is a huge industry. So we saw the effect of COVID-19 on toilet paper supply chain, right? And another big trend that's happening right now is the way people shop and consume products is not by going to the store, is by getting Amazon and like derivatives to deliver packages to their door. And as we all know here on the call today, right, all those packages get delivered in paper recycled pulping products, a box, right? So can you imagine how many hundreds of millions of parcels are used every year by Amazon only to ship those products to our households? It's a huge impact. So can we make trees 10, 20, or 30% more amenable to the pulping process to have a more sustainable supply and delivery chain? Can we use less energy and fewer enzymes and fewer trees to get the same amount of pulping product? So that's what we're working on right now. It's one of those things I think we can make a huge impact. And sadly, because trees are big and trees are slow and trees are demanding, not enough people work on trees. So for every 100 breeders you have for corn, you may have 1 tree breeder. And up until now, when I talk to tree breeders, they say it takes on average 25 years to go through a tree breeding cycle. So somebody who's been in the tree breeding industry can go maybe to 2 generations of trees at most, right? If they have a good career, maybe 3 if they really do that early on and finish late. And I think with technologies like CRISPR, we can accelerate that. And we can enable breeders not just to do it better and more affordably, but to do it faster. What if we can change 25 years into 10 years, or 10 years into 1 year, right? And if we can do that, then we can accelerate our ability to really engineer, design, breed, imagine, and develop, and literally seed a more sustainable forest. So, we're very early on, right, in terms of 3 years in that new company here, but I'm very excited about the upside of trees. And I think it's a good illustration of how disruptive technologies that make better food, or better crops, or better COVID-19 vaccines, or better diagnostics, or better gene therapies, that same general principle and technology can be harnessed and redirected to solve things like global warming. So I always find that inspiring. It has its own challenges, but again, we're gonna have a more science and work our way through that.
Indeed. Now we're coming up to our last few minutes here, so I encourage yeah, our audience, if they have any questions, to please put it into the chat box. But I wanted to thank you so much for your time here, and I also wanted to say I spy the Canada Gairdner International Award behind you, I think. So you are a recipient of that award, and part of the reason we're talking today is because of the Gairdner Foundation facilitating this conversation. I want to send our thanks to them. Now, it's a hugely prestigious award. The Gairdner Foundation was established in the 50s with the main goal of really recognizing and rewarding excellence in fundamental research impacting human health. You've won both that award, and you're the co-recipient of the Warren Alpert Foundation Prize, which is done in partnership, I believe, with Harvard Med School. I've read that a significant number of winners of both these awards go on to win the Nobel Prize. So you're doing really, really, really impactful work here, and I thank you very much for joining our conversation. I'm just going to go. We have a couple of questions here from our audience, and thank you. It's we still have a few minutes if you'd like to ask your question. And one is, I'm sure as a food researcher and a scientist and one involved in probiotics, you spoke about trends in food. You mentioned kombucha and kimchi earlier, and if we're looking at commercial applications of probiotics in the food, we saw you mentioned yogurt and cheese. What's on the horizon from a real commercial consumer level that you can maybe tell us about?
Yeah, so the microbiome, right, which is the community of organisms that live in us and with us and on us, can be impacted using probiotics. So I think it's self-explanatory to imagine how the food that we eat or the dietary supplements that we consume can impact our GI tract, right, our gut intestinal tract, right, gastrointestinal tract. So the same general principle can be applied in other environments, like the urogenital tract. So we have some projects looking at women's health, right, and the vaginal microbiome to find out things like bacterial vaginosis. So I think we're not very far away from people saying we can use probiotics to promote and enhance urogenital tract health. Or at the same time, it's also for the skin microbiome. So we have a project working on acne, right? Bacteria responsible for acne, and trying to change the skin microbiome to manipulate the skin microbiome towards a more healthy balance and remove the ones that are responsible for acne, like Proteobacterium acnes, Cutibacterium acnes, and then replace them with beneficial microbes that are non-acnogenic. And you can think we're going to use that on the line with pets and pet gut health and pet reproductive health and pet skin health, right? And on and on and on. Eventually do that with plants as well. Can we use probiotics for plants to control their yield? Can we feed probiotics not to our pets, but to our livestock so they don't have to consume as much antibiotics to fend off infectious disease? So I think all the microbiomes that we can think of can be very extensively and powerfully impacted by probiotics.
Okay. And finally, we have a question from Monica, who is joining us in our audience. Monica asks, what do you think about the commercialization of CRISPR technology so that anyone in the public can purchase it or to use it on themselves or others? What do you think of that accessibility question to the general public?
So I think it's very interesting, right? There's a whole biohacking industry that's saying you can use CRISPR in your garage, you can use CRISPR in your kitchen. There's some interesting and intriguing things online you can watch on YouTube. You can watch on Netflix. There's a great documentary, Human Nature, I was involved in that explains the story of CRISPR, how you can use it. And the power of a technology like this is that in some cases, you don't need to be a genetics expert to use it. So you can, quote unquote, biohack, or you can, quote unquote, do citizen science on it and use it to do things. Now, to use it on yourself is not trivial whatsoever. How to deliver it, how to engineer it, we're still a little bit far away from that. You can use CRISPR to make fluorescent E. coli in your kitchen if you want. We have a lot of projects that are working with high school students and moving forward, even middle school students, that enable them to manipulate the DNA of some organisms of interest in a lab setting. But to do so and inject yourself with your own custom-made gene therapy is not advisable. There's some stunts that have been documented online and in documentaries and movies of biohackers using this on themselves, and it's not advisable or recommendable, so you shouldn't do it at home, right? Don't self-medicate. It's a very good first do no harm suggestion. Secondly, it not only did it not work, but they could really be at risk of negative outcomes. And for those of you who watch the actual documentaries where people have been documented on film and on camera to use it on themselves, it ended tragically. So this is a concern that we have to be mindful of. This is something that we have to be aware of. This is not necessarily something we have to be fearful of, because if you don't do anything bad, it won't be a problem. But as always, the challenge is not the technology itself. It's neither good nor bad. It's neither dangerous nor safe. It's how you use it and who is using it. So if you want to do gene therapies, go to a gene therapist, right? It's as simple as this. And I would advise against people trying to change their own DNA to make themselves better. There's a lot better, easier, and more pleasurable ways to read in humans. Do not use CRISPR on yourself, but do watch the movies. It's very interesting and can lead to a very colorful conversation at home during quarantine.
And so don't try this at home.
Bacteria, yes, not on yourself.
Yes, right, not on yourself. Yes, exactly. Rodolphe, thank you so much. We've run out of time, unfortunately. It's been an enlightening hour. Thank you for giving us your time and your expertise here. Good luck with all of the work that you do, particularly in the COVID research and with TRICO. And thank you so much for joining us.
All right, thank you for having me today. And as always, keep calm and CRISPR on.
That's right. Thank you so much.
All right,
Take
cheers.
care, everybody. Bye-bye.